Good evening and welcome to the clinic. My name is Dr. Latenight. I understand you're not feeling well today, is that right? I'm sorry to hear that. So it says here that you're experiencing some irritation in the throat as well as some pain in your sinuses and congestion. Is that right? Okay, well, today I'm just going to examine you and we'll be specifically focusing on your ears, nose, and throat. And I promise you we will get to the bottom of this and figure out what's going on with you. Okay? Perfect. So, just a quick question for you. Do you have any history of ear infections, sinus infections, strep throat, or pneumonia? Okay, alright. Well, we'll eliminate all of those as possibilities today. So, I'm going to first feel around your face and your throat. And as I'm feeling, I just want you to tell me if there's any tenderness anywhere, okay? Okay, so starting at your sinuses, just above your eyebrows, I'm just going to press. Is that tender there? Okay. Alright, and then on your cheeks there, that's tender too? Okay, alright. Now I'm going to feel your glands as well as your thyroid, which is also a gland. So just under your chin here, is that tender and painful? Okay, and on the side of your throat, it's tender as well? Okay. And then just your thyroid gland here. Is that tender? Okay, that's good that that's not tender. That eliminates some possibilities. Now, before I go into more in depth with the examination of you, I just need to take a quick look at your eyes. And I'm just going to be looking for any drainage here, as that can indicate other problems. Okay. So what I want you to do is look up, and I'm just going to pull down on your eyelids very gently. Okay, I don't see any excessive drainage there or redness of the eye, so that is good. You can look forward again. And now I'm going to listen to your breathing, and what I'm looking for here is just any crackling, as that can indicate something like pneumonia. Okay, so I'm going to put this on your chest. It might be just a little bit cold. And take a deep breath in for me and out. Good. Once again, breathe in. Okay, and out. And I'm just going to come around your back here as well. Breathe in and out. One more time. Breathe in and out. Okay. You are wheezing just a little bit, but I don't hear any crackling, which is good. Now I'm just going to take this light and do a sort of cursory look in your ears, nose, and your throat. So if you can just open up wide for me and say, ah, good. Really quick, do you have your tonsils still, or have they been removed? Okay, perfect. Once more, just say ah for me. Again, this is just to get a quick look. I'll look again later. I do see, I believe, some spots in the back of your throat. So we will do a strep throat test later just to make sure that that is not what's causing problems for you. Okay? Now, I have this little light wand here, and just like I looked in your mouth, I'm going to look in your nose and in your ears, okay? So if you'll just turn your head to the side a little bit for me, and I'm gonna look in your ear. Okay. And in the other ear over here. Okay, and again, I'm going to look in your nose here, so just gently pressing up on your nose, looking in each nostril. It might feel a little bit funny, but shouldn't be painful at all. Okay, very good. Now, continuing on with the examination of your nose, I want you to just hold one nostril, okay, and take a deep breath in and out. Good. Okay, and the other nostril, take a deep breath in and out. Okay, very good. Any issues with that? They feel a little clogged? Okay. Well, that is to be expected when you're sick, but let's just see here exactly how much that is obstructing your sense of smell. So I'm just going to have you sniff this. First of all, do you have any allergies? Okay. So just cover one nostril again. Take a deep inhale. And can you tell me what that smells like? Good. It is lavender. And go ahead and switch nostrils. And take another deep inhale. Good. Lavender again. Does it smell about the same on both sides? Okay, but it's not very strong of a smell, right? Okay, gotcha. So I have a couple of tricks that I'm going to teach you that may relieve some of the pressure in your nose and your sinuses. It's not a perfect cure, and again, we will figure out exactly what is going on with you today so that I can prescribe something to make it all go away. But in the meantime, just to alleviate some of that discomfort, I'm going to teach you a couple tricks. So for some people it works, and if you'll just do this along with me, you're going to press not too hard but firmly right in between your eyebrows. Release, and then you're going to press your tongue up pretty hard to the roof of your mouth, the hard palate. And you're going to alternate these motions. So press on your eyebrows in between, and then press up with your tongue. Good. Eyebrows, tongue, eyebrows, and tongue. And doing that back and forth, there's something about it that tends to loosen congestion up for some people. But if that doesn't, another technique you can use is to take the tips of your fingers and gently massage right above your eyebrow in circular motions. And you're going to slowly move out towards your temple. And again, this is just a quick demonstration. You can take more time to do this to really do a good job. But starting again in between your eyebrows, then you're going to move down your face to your lower sinuses here, all the way across your cheek. Again, just using those circular motions, not pressing too hard, but hard enough to sort of move around and release that congestion, okay? So those are a couple tricks you can take home with you. So moving on to your throat now. Can you just take a big swallow for me? And I'm just going to observe your neck as you do that. Okay, good. Was that uncomfortable? Alright, I'm sorry. But that does give me some information, of course. So I'm going to, just as I did earlier, take a look in your mouth. But I'm going to be a bit more thorough this time. So if you can just open your mouth wide and say ah again for me. I'm going to depress your tongue here and just take a look. Say ah again. Okay. As I suspected before, I do see some spots in the back of your throat, which can indicate strep throat. It also looks very swollen back there, so it's apparent why you are having some discomfort. Okay, and really quick, will you just stick your tongue out for me? Good, and if you can move it to one side, just so I can see along the edge. Okay, and the other side of your tongue, please. Okay, yeah, we do have some swelling and spotting there as well. So I am going to test you for strep throat. This will just require me to use this cotton swab, and I'm going to, it may be a little bit uncomfortable, but I'm going to swab the back of your mouth and your throat, and then I'll be putting it into a solution, and after just a few minutes, depending on what color it turns, that will indicate whether or not you have strep throat. Okay? So open your mouth again, say ah. I'm just gonna swab in there. Just relax. It'll only take a moment. Just have to get, if there's any bacteria, have to get it all up on there, okay? Okay, good. You can relax. And I have some solution here. Just swirling it around. And the chemicals, again, will react with the germs. And if you do, in fact, have strep, we will know in a minute here, okay? So, finally, to conclude all of the tests and examination of your mouth, I'm going to sprinkle something on your tongue, and I just want you to tell me if you can taste it, what it is, and how strong the taste is to you compared to your normal sense of taste, okay? So we're testing to see if the functionality of your taste buds has diminished with illness, okay? So just taking, this is a common household substance, something that is in a lot of food. You're not allergic to anything, are you? Okay, good. So if you will just close your eyes and stick out your tongue, I'm going to sprinkle something on there. And can you taste that for me? You can open your eyes again. Okay, yes, that is sugar. Does it taste as strong, as sweet to you as it normally would? Okay, it's tasting a little bit fainter. Yes, oftentimes when we're sick, we will lose our sense of taste a little bit, so that confirms that. Finally, while we're waiting for your test results, I'm going to take a more in-depth look at your ears, and this includes testing your hearing to see if you're having any issues with it. Sometimes when we're incredibly congested, our ears can get kind of filled, and it obstructs our ability to hear properly. So I'm going to conduct a quick hearing test by just whispering in either of your ears. And I want you to tell me if you can hear what I say and repeat it back to me, okay? Ready? Did you hear that? Uh-oh. Okay, let's test the other side. Did you hear that? Okay, yes, you're definitely having some issues with your hearing. Let me take another look in there just to see if there's any debris that we can clear out to reduce your discomfort and stop it from obstructing your hearing. Excuse me. So again, just turn your head to the side a little bit for me. And I'm going to look in your ear. Okay, I see now. They are a little clogged, at least on this side it is. Okay. And turn your head to the other side. We're going to look in this one as well. Yep. Yes, indeed, they are both clogged. Okay. So, I'm going to go ahead and clear out your ears for you just a little bit. This is not advisable to do at home, okay? You're not supposed to normally put these in your ears, but I am a medical professional and I'll be doing it very carefully. So do not try this at home. But I'm going to take this cotton swab and just spraying it a little bit with some ear cleaning solution. Okay. So again, turning your head to the side just a bit for me. I'm going to just clean in there. Okay. Moving it around. Okay, very good. And the other side as well. I'm going to clean the interior of your ear. So look to the side for me, please. Okay. And just moving it around in there. Getting out all of that gunk. Okay. Perfect. You can look straight at me again. And I'm going to wipe the exterior of your ear as well with these little cotton balls, just because we dredged up a little bit of gunk there, so I want to make sure you're all cleaned up and ready to go. Okay, swabbing the outside of your ear. Good. And on the other side here, just relax. Good. Okay, perfect. So now we're going to test your hearing once more just to see if that made a difference, okay? Going to whisper something in either of your ears, and I want you to repeat it back to me if you can hear it, okay? 72. Okay, good. Definitely made a difference, huh? And on the other side, 49. 49. Very good. Alright, well, it seems like we've eliminated that issue, but I believe it is time to check your strep test here. So just taking the swab out, and I'm going to just wipe it on this test strip here. Good. Okay, give it a moment to react. Yes, it seems that you do in fact have strep throat. So that is concurrent, makes sense with my findings today as well. Yes, these tests tend to be very accurate. So what I'm going to do is I'm going to prescribe you a series of antibiotics, okay? You're going to take these twice daily for a week. Okay. Yes, they're just pills. It's very easy. Okay, good. And I must let you know, even if your symptoms desist, go away after a few days, it is very important that you finish the round of antibiotics because they can come back. Okay. Strep throat can be very persistent. So before I send you off with your medication, your antibiotics, I have a few more just tips and tricks for you to alleviate your symptoms while you still have them, okay? So if you're experiencing sore throat, I would recommend, of course, drinking hot beverages like tea, things like soup. Throat lozenges are very helpful for some people. The menthol in them can have sort of a numbing, cooling effect that helps a lot. Also, for both your throat and congestion, I would prescribe hot, steamy showers. Yes, this can alleviate and break up some of the congestion in there, allowing you to get a better night's sleep. Okay. And finally, I would recommend lots of hydration and rest. You need to make sure that you are drinking plenty of water so that your body is healthy enough to fight off this illness. Okay, perfect. So I would recommend that you go home right now and take a nap, go to sleep for the night. Just rest up as much as you can, alright? I hope you feel better. Make sure you take your antibiotics on time, on schedule. Perfect. Okay. Thank you so much for coming in to see me today, and I hope you feel better. Good night.